What is the role of an orthodontist in this field?
Orthodontist judges where is the correct placement of the teeth.
For the easy cases where the malocclusion is not much, an aligner is preferred over braces because aligners are removable. So it's easy to maintain. You can easily maintain your oral hygiene. You can brush normally. If you're traveling also, since you have set of aligners, you can travel with them. And with the braces, you have to visit again and again. Even what is, like, if I may put it in the layman's term, as maintenance issues
Is ideally speaking by age of 7.
Hello everyone, hearty greetings from HSR Dental Clinic and Implant Center. I'm your host, Dr. Deepak Daryani, and today's podcast is on the field of dentistry, which is called as orthodontics. Now, orthodontics deals with malaligned teeth, and it deals with aligning the malaligned teeth by various methods like braces, aligners, etc., etc. We have with us Dr. Jemoy James. I'm very proud to introduce her to you all today because she's also my student. When she was doing BDS, I taught her, and it's been a long journey. She was a fantastic student. She was a gold medalist in both BDS and MDS, followed by which, as they say, it's a small world. I came down to Bangalore, and she also happened to come to Bangalore, and she's there in our clinic from quite many years now. And today she is going to give the current evidence-based dentistry knowledge related to orthodontics to all our listeners. So I welcome here Dr. Jemoy. It's a pleasure that you are here. You could take out the time. Let's start with our conversation about talking about yourself. How was your journey? Where did you do your education from, and how did you land up here?
Thank you for inviting me for this podcast. I've done my BDS from New Horizon Dental College and Research Institute in 2006 and post-graduation in orthodontics and dentofacial orthopedics from Chhattisgarh Dental College and Research Institute from 2016. Why I chose orthodontics as a specialty is because whenever a patient comes with an inconfident smile or a bad bite, when we treat, though the treatment is longer, but the results what we get is lifelong, and the confident smile which they give us at the end of the treatment is really a pleasure to our heart. That's the reason I chose orthodontics.
Awesome, Dr. Jemoy. Now, please tell us, what is the role of an orthodontist in this field of dentistry?
Orthodontist judges where is the correct placement of the teeth which matches their face. Sometimes the teeth might be malaligned, but patient is not concerned. But that may be hampering their bites. Okay, so all those things can be judged or evaluated by orthodontists, and also the jaw positioning, like when it's regarding about the cosmetic things, the straighter smile, all those are judged by orthodontics.
All right, Dr. Jemoy. So the next question will be, when should one visit an orthodontist? Or let me put it as, what is the right age at which a child should be shown to an orthodontist, or parents should come with the child to show it to the orthodontist?
Okay, so the best age to be evaluated, like the first screening, is ideally speaking by age of 7, because that is when the first milk tooth come, permanent tooth come. But that does not mean the treatment will start that early. It is just to screen them what is going to happen in the future. Okay, especially if a child comes between 7 to 14 years of age, we can utilize the growth spurts and we can correct the jaw positioning, which might not happen when the patient comes in adult age. But also, patient can come in any age. The treatment can happen in any age. There is no hard and fast rule that only children can go for orthodontics. Even adults can go for the alignment of the teeth.
All right, doctor. So, doctor, the next question will be, what are the various options which you have for the patient for correcting the teeth, correcting the smile? The main problem which with they will be coming to you is malaligned teeth. So, what are different options are there in orthodontics for correcting such malaligned?
There are broadly two options. One is with the braces, which are fixed on the teeth, and another one is aligners, which are removable and pretty transparent. Then coming to the braces, there are a variety of braces. Like it can be metal, ceramic. Metal will be steel in appearance. Ceramic will be white color. Also, there are another system which is self-ligating braces. So in that also metal and ceramic. The various advantages and disadvantages, we decide on the severity of the case or what case, which braces required, that is decided by the orthodontist. Then coming to the aligners, it is pretty transparent and removable. Apart from these two broad categories, we have another appliances also like screws, expansion screws, other myofunctional. Now, depending upon what kind of treatment is required for what problems, there are other options also like surgeries and all other complex things. These are the simpler ways.
All right. So let's go a little bit more into detail, doctor. If you can explain how these braces actually works, how they bring about changes in the malocclusion, how they move the teeth, how they correct a malaligned teeth into well-aligned teeth.
See, the braces are fixed on the teeth with an adhesive. They impart some pressure to straighten the teeth to align it. So it gives some mild forces to align according to the wire.
So how long these braces work for? Ideally, if you can tell a ballpark figure, how much time the braces takes to align the teeth?
It depends on the severity of the treatment. But in generally, if you can ask me, it's almost the treatment time will range from 15 to 18 months. But again, if we are concerning about the mild corrections, it might get over in couple of months.
All right, Dr. Chimay. So, Dr. Chimay, one very common question which is asked by the parents and the patient is, does these braces hurt because they look something metal attached to the teeth? Does they hurt? How uncomfortable it is? And what all problem a patient can face due to wearing these braces?
This is a very common question every patient asks me. It's actually very painless. While we place the braces or aligners, it's very painless. But patient do feel some discomfort after a couple of days, like because they feel some tightness, but it's not really painful.
So, doctor, what lifestyle changes a patient may have to make when they are wearing braces? Like, are there certain kind of food they can't eat? Will there be more food lodgement, and how to maintain it? So, in general, what all things a patient can expect after wearing these braces?
It does require some short lifestyle changes, short term. It's since the braces and aligners are only temporary, no, so just few months. Like brushing, you have to brush more than the normal individuals because the food will get stuck in between. You have to clean, so more hygiene maintenance. And when it comes to eating, you have to make it into small pieces and eat. You have to avoid sticky foods or the foods which can break the braces, like nuts or any hard food. Other than that, everything remains same.
Okay, all right, doctor. So, if I have to summarize what you said, the minimum time frame which a person can look it as 4 to 8 weeks, and it can extend up maybe up to 10 to 12 weeks. And if you are wearing a conventional braces, you may have to visit once monthly for that period of time when the treatment is going on, right? Okay. So the next question will be, doctor, what all things a patient can't do after wearing the braces, or he may have difficulty like playing sports. Some parents are, concerned that the child plays football, or they do wrestling, or they do boxing. So, what are the restrictions when it comes to playing sports or pursuing their hobbies like playing music instruments? So, what is your advice regarding that?
Yeah, they can definitely do all the sports, but like direct contact sports like boxing, wrestling, all those things, it's advisable to use a customized mouth guard. Otherwise, it's fine.
All right. So, if I have to summarize what you said, if it comes to very aggressive sports like wrestling or boxing, they may have to wear a customized night guard over the braces. Otherwise, it should not be much of concern in other things. Doctor, the next question is very important. It's what is the difference between braces and aligners, and what are the benefits associated with each? What are the pros and cons, and how can a person judge what is the best for them?
See, aligners are removable, as I told. So it's more easy to maintain hygiene, less food restrictions. So lifestyle changes are less as compared to the braces, which is fixed over the teeth. So more brushing and all is required. Second thing is aligners are pretty transparent. It's hardly visible. Third, it is less number of appointments are required. So less number of visits to the clinic. If you are traveling, all those things comes into account in a busy schedule. You can choose aligners as compared to the braces. Then emergency visits will be more for braces. Like suppose some poking wires or bracket breaks. All those will not be there, almost not there in aligners. Then if you ask me about the comfort, aligners are more comfortable. It's less painful as compared to the braces.
All right, doctor. So, for the easy cases where the malocclusion is not much, an aligner is preferred over braces because aligners are removable. So, it's easy to maintain. You can easily maintain your oral hygiene. You can brush normally. If you're traveling also, since you have set of aligners, you can travel with them. And with the braces, you have to visit again and again. Even what is, like, if I may put it in the layman's term, as maintenance issues are more with the braces as compared to aligners, because there are some pokiness which patient may feel as a tooth moves. There can be the wire which is poking the soft tissue, and patient may have to visit. So maintenance issues is more with braces as compared to aligners. And of course, the journey is much more easier with aligner as compared to braces. However, if the cases are very complicated, there are skeletal malocclusions, then probably the braces will be a better choice over the aligners, because aligner may not be able to give 100% results as compared to braces in the complicated cases scenario. I think that will summarize. All right. Okay. So, doctor, the next question will be, what are the common questions and problems they ask you about?
The most commonly they ask, what will happen if I don't get treated? If they don't get treated, the teeth will not get aligned themselves. But in turn, it will cause some other problems, like you are not able to maintain hygiene, caries can happen, gums problem, bite issue. All these can happen in future, not if not now, but in due course of time it can happen if it is not. And of course, not a good smile is if the teeth is not aligned well, you'll not have a good smile. Though always an inconfident smile will be there. The second question which I face is, am I old for the braces? No, there is no age limit for the braces or aligners until your bones and gums are healthy. The supporting tissues of the tooth, if it is healthy, we can go for the braces or aligner at any age.
All right. Dr. Jimai, one question which is often asked is about the retainers which needs to be used after the finishing of the orthodontic treatment. We know that we put either fixed retainers or removable retainers. The question is, what is the role of retainer? Why do we need retainer? for how long a person may have to keep wearing the retainers?
Retainers are the appliances which hold the treatment results. What happens is we are moving the tooth with some forces. The tooth were in some position for so long, and then we are applying some forces. Teeth is a living tissue. It's like elastic. So it tends to go back to its original position. It has a tendency to rebound. To prevent that, retainers are given. Like once we finish the treatment, we have achieved all alignment. To maintain that position, the retainers are given. The retainer has to be worn according to the severity of the malocclusion. Again, like if it's a simple case, you can wear for a year or like that. Or for some cases, we advise a permanent retainers also.
Let's conclude this podcast by thanking you, Dr. Jamoy. I think you gave a great insight into this field of dentistry. I think we should have more sessions like this because
Sure.
it will really help the listeners to understand and get the current knowledge actually.
Right.
Because see, the dental knowledge keeps evolving. It's very important that we impart the current evidence-based knowledge, which is the goal of this podcast, and try to do a holistic treatment to the patients, do an interdisciplinary treatment so that we can do more predictable long-term outcome. We can get more predictable long-term outcome. So thank you.